So I'm here at Perky with a nurse duo who specialize in medical tattooing for breast reconstruction, nipple reconstruction. So Courtney, Crystal, do you guys want to introduce yourselves?
Yeah, I'm Crystal and this is Courtney, and we're the founders of Perky, and we're here in the San Antonio Medical Center. We have combined over 10 years experience working with the breast cancer community, and we offer different types of services. So from 3D, 4D nipple tattoos to eyebrows, pre-post chemotherapy, radiation marker camouflage, scar camouflage, you name it, we've thought of it and we offer it.
Oh, that's awesome. So Courtney, how long have you guys been doing this?
We have been open for about 1.5 years, but we've been tattooing, like Crystal said, with the breast cancer community combined over 10 years. So we know a lot about nipple tattooing for sure.
That's great. I'm looking forward to asking you questions so we can learn exactly what you do and how you do it and how patients can benefit from seeing you guys.
Yeah, well, what we noticed is in a lot of doctors' offices, the nipple tattoo was an afterthought. We've even had clients tell us that, or that it wasn't discussed with them at their appointments. So they were oblivious that this was an option. So it's great to be able to educate them and offer them something that's really restorative for them.
That's great. I agree 100%. I think that that should be one of the main areas that should be focused on because patients really benefit from it and
Totally.
it completes the reconstruction. So I agree.
But we love what we do, and the fact of the matter is that breast cancer is not going anywhere, and these women deserve the best in their recovery from diagnosis to survivorship, and that's why we're here.
You guys do, so tell me what you do. So how does Perky help patients that have breast cancer?
So after a patient has had breast reconstruction with a plastic surgeon like yourself, they come in. We always offer complimentary consultations, and we go over 3D versus 4D nipple tattooing techniques.
Mm-hmm.
And it's kind of the cherry on top of their breast reconstruction.
Yeah, I agree. I've actually used that analogy, cherry on top.
Yeah.
That's absolutely the case. When we have patients that come in, they have the breast reconstruction. For us that see it every day, we can kind of visualize what that end product's going to be like. But the person who's going through that experience, a lot of times they can't picture the end result and how that's going to look. So they're just kind of focused on, I don't have my breast, or maybe I have a breast mound, but I don't have everything there, such as the nipple and the areola. And what you guys do is, it is the cherry on top. It finishes the reconstruction, and I think it looks great, and the patients love it.
I think it's important for the patient to know, maybe at time of consult, what lies ahead, so that they're not so fearful, or they have a better grasp of what to look forward to.
Yeah, ideally they've talked about those options with their plastic surgeon ahead of time, although I don't think that always happens. So it's really nice when they're shown up front what they can expect after surgery.
Yeah, that's great. That's great.
Then they're okay if they have to lose their nipple.
Right.
Mm-hmm.
Yeah.
So Courtney, I have a question for you. I know patients when they come to see me and they've done the research, they've looked up things online, they've gone to different platforms, and there's great discussion groups and support groups out there. They ask about 3D and 4D nipple reconstruction. Can you tell me a little bit more about that?
Absolutely. So it's really awesome nowadays. People have options of whether they want to have that nipple bud surgically recreated. If they've had nipples removed, they can actually have their surgeon make a nipple bud out of their skin, and then we can tattoo it, and that gives a really realistic look. It has a protruded nipple bud. Mm-hmm. If you don't want to have that protrusion all the time, 24/7, or you don't want additional scarring, you can do what's called a 3D nipple tattoo, where we give you the illusion of a protruding nipple bud, but it's flat when you turn it on its side.
Okay, and you do that with different shading techniques and your kind of artistic ability, is it?
Yes, we actually use the same technique when we do 3D and 4D. It's just not on the actual nipple bud, so we line and shade and give it a lot of character with different colors.
That's great. Yeah, it looks great. I think I've had a lot of patients, especially in the past few years, prefer to do the 3D nipple reconstruction without the surgically created nipple, and I think it's a great option. I think patients appreciate that they cannot have to wear a bra all the time, so that's a nice benefit of it.
Less scarring.
Less scarring, less downtime.
Yeah.
So
and you get more of a choice in placement when you don't have a nipple bud there.
Yeah, I think we had a mutual patient recently that had a skin island from a deep flap, and it was a little bit positioned low, but you guys just went ahead and did the nipple reconstruction in the ideal location, and she looks fantastic, like really nice.
Yes, and not all nipple buds are created the same. So some of them heal more flat, some of them heal larger, more projected. So you're not always getting exactly what you were picturing when you do it surgically. So you can really have more of a say in it when it's a 3D. So what's your experience with 4D nipples? Seeing them flat, projected?
Yeah, that's a really good question. Some of that is patient factors. So, I mean, obviously from a surgery standpoint, there's different techniques to do nipple reconstruction, so the 4D approach. Some have better projection. From my experience and the way I do things, I think I get pretty good at projection and long-standing projection. That's often a common thing that patients will complain about or that they've read about and they're concerned about is not having good projection in the long term, that it flattens out. That has not been my experience doing the technique that I use. But some of it is patient factors. So if you have somebody who has really thin skin and the dermis isn't very thick, when you do the nipple reconstruction, the soft tissues just don't have the support to maintain that projection. And in that situation, the patient will have a loss of projection and a flatter nipple. So sometimes you can tell that ahead of time by your examination. So if I'm examining a patient who has had prior pregnancy and the skin and the dermis has been stretched out, and I can appreciate that they have very thin dermis, that patient probably be better served with a 3D nipple reconstruction because the 4D nipple approach is not going to be of benefit, and she's going to get the downtime and the additional scarring. So for that person, I think 3D is going to be the best option.
So you'd say there's certain times when people are absolutely not a candidate for 4D nipples. Yeah,
and it's not so much that they're like it's an absolute contraindication, but they're just not going to get the benefit of it. So for them, I wouldn't recommend it. For us, and I think we all have a similar approach, is we educate our patients and we want them to make the best decisions for themselves rather than us kind of saying, hey, this is what you need to do. We don't do that. That's not our approach, and I think I enjoy working with you guys for that reason. We have a shared philosophy and that we educate our patients and help them to make the best decision.
Absolutely.
Yeah, it's really sad when it's not a conversation that they're part of. When they just wake up and they're like, oh, I have nipple buds.
Yeah, exactly. We shared that decision.
Well, I think a lot of surgeons maybe don't offer fat grafting. Is that something you do?
Yeah, fat grafting is great. It's a great adjunct to reconstruction. It's usually done at the second stage. For an implant-based, if you start with a tissue expander, it's usually done in 2 stages. Sometimes it's not. But if you're going to do fat grafting, it's usually done at second stage. And it's an opportunity to help mask some of those contour irregularities, also add some volume, so that can be helpful for the reconstruction. And if you've had autologous tissue, same thing. We can improve the cosmetic outcome at that second stage with fat grafting.
And that'll help the donor site too.
Yes, that's a little silver lining as we do some liposuction in an area where patients may have a little trouble still, or they just want to donate from. So I'm happy to do that.
Yeah.
Are there scenarios where you use both tissue and implant for reconstruction?
The hybrid.
Yes. It does. It's not my preference because I think you kind of get the worst of both worlds. If you're having an autologous reconstruction, you have the benefit of never having to have anything in the future. It's a lifetime reconstruction, right? But if you introduce an implant, now we have the donor site issues that you had with the flap. So you have the scarring associated with the flap, that's the trade-off for using your own tissues. You have a scar at a donor site, but you also have the downside of having an implant, which is it's going to have to be replaced at some point. It's not forever. But again, it's not my preference, it's the patient's preference. So if a patient says, volume is really important to me, and I know the tissue that I have is not going to be sufficient to do that, I think I want to have both, then that's the best option. That's the best option for that person, right? Yeah.
Something I'm just curious. Someone who has metastatic breast cancer, how do you approach breast reconstruction with a stage 4 patient? I know it's tricky.
Yeah, it's very tricky. It involves conversations with the oncologist, the surgical oncologist. You want them to have stable disease, so they can't be having any worsening progression. They have to be in good health. But that's a decision that's going to be made as a team at that point. It can be done, and we do reconstructions in those exact scenarios. But it is absolutely a team discussion involving multiple providers and the patient.
So like we mentioned, it takes a group approach to breast reconstruction. Thanks for being here today, Dr. Garza.
Thank you for having me. I had a great time catching up with some old friends and,
Yes.
and discussing some of the important things we talked about with regards to breast reconstruction.
And we are really excited about your new practice opening. You said in January, hopefully?
January, hope to have doors open and seeing patients, and I'm super excited to build a team that has that same approach to patient care. So, thank you.
Awesome.
So you have breast cancer in the San Antonio area, you need breast reconstruction, he's the guy for you.
Thank you.